This is the most severe form of nasal asymmetry that we find here in the anatomy. The nasal septum is probably not quite straight either, but the main problem is really this complex deformity of the alar cartilages, which are totally uneven.
My name is Kasif. I'm the anesthesiologist. We're going to give you a general anesthetic. That means I'll be setting up an IV line shortly. We'll put you to sleep through that IV line. You will then be intubated. That means you'll get a breathing tube. The tube is then advanced through the mouth into the windpipe and you'll be artificially ventilated, okay?
I'll be under anesthesia, right?
You'll be under anesthesia. You won't notice. You'll be relaxed and asleep during it.
What's just very important to me is if any complication arises or my circulation drops, that we then stop. I mean, that you bring me back then. I'm really very afraid of that, of this loss of control or that something will happen to me because I have massive circulatory problems.
Yes.
So
We would have done that anyway.
It's somewhat psychological, I think, that I get worked up about it and then it happens subconsciously that I get very agitated and I had those difficulties and complications during childbirth too. That's why I'm just very unsettled by it.
That won't be a problem. Yes, we'll be monitoring everything the whole time. Your heart rate, your blood pressure.
You're experienced, right? You'll bring me back then.
I am experienced, exactly. We'll take good care of you. Yes, don't be afraid.
Okay.
Okay, see you in a bit.
Yes, see you in a bit.
How are you doing?
I'm a bit nervous, excited. I told you that on the phone, but honestly, I'm really just trying to calm myself down a little bit now, and I just had a good preliminary talk, which actually calmed me down a bit.
You have to accept a little bit that you're excited. That's a completely normal reaction, especially on the day of surgery itself, even if you were maybe quite calm before. That actually happens to almost everyone. The important thing is that we aren't excited. None of us are excited. We're all very calm. And I'll just start by taking another quick look at the nose. What bothers you the most? Can you put that into your own words again?
The tip of the nose that when I laugh, it goes down.
Yes.
The noticeable bump on the right side, that is actually not symmetrical at all.
Yes.
And yeah, I feel like it doesn't quite fit my face. I'd like it to be a bit prettier and without these bumps and this parrot nose, as I call it.
Regarding the breasts, do you find them too small or too large now?
Well, I find them a bit too small now, because due to the pregnancy...
They've changed a bit.
Overstretched. Exactly. But I had already factored that in back then. So this natural result, that's just important to me, that they're not too big, but I'd say they could probably have a bit more volume now because I've also gotten older and heavier.
And you're in the horse industry, right?
Exactly, right?
Good. That's why you're a bit worried that the shoulder girdle will be a bit too stressed if we place the implants under the muscle, right?
Right. And that was also the reason back then why I had this implant placed over the chest muscle.
We'll take a look at that in a moment. If necessary, we can place the implants under the so-called muscle fascia. That way you get a bit of the best of both worlds. We do that in cases like this, or sometimes with fitness athletes too. That's not all that uncommon, even though we more frequently place the implants under the muscle, of course. Then we'll create a new pocket under the muscle fascia, so to speak. You see, the muscle has such a thick layer of connective tissue, and we use that so the implant has a bit better coverage. The advantage is that you'll primarily have fewer complaints. It's not at all that if the implants are placed under the muscle, you'd be out of action forever, but it just feels different, and I think that's important for you too. Especially since you move your shoulder girdle a lot, this will naturally be a bit more comfortable in the initial phase. I'm just going to briefly mark the breast again. Do you have any discomfort in your breasts?
Sometimes they hurt a little bit at the nipples on some days. So they're just so hypersensitive there.
Okay, that's it. The good thing is when you see patients that you've operated on before yourself, I know what to expect there.
Yes.
There won't be any surprises. I know how I prepared it. Nothing will be damaged in terms of anatomy, and so you don't have to worry about the procedure.
Great.
Okay, then I'd say let's get started now. Today we have a nice patient whom I already know. I actually operated on her breast a long time ago. It still looks beautiful, but after pregnancy and breastfeeding, her own breast tissue has naturally receded a bit, and now she wants a bit more volume. That's what we're going to do today. Then we have a relatively complex nose surgery, and we're going to tackle that now. I think we'll need about 2 hours for it, maybe 2.5. Oh, she has a hole in her nasal septum, I just noticed. Here is the challenge, the complex anatomy of the tip of the nose. I'm going to visualize it through the nostrils for now, but I'm pretty sure I'll have to open the tip of the nose a bit more as we go. So I've started with a closed rhinoplasty for now and have gotten an idea of the alar cartilages. She really has an extreme congenital deformity there. I don't know if she ever took a hit to the nose, maybe as a small child, which would also explain the hole in the nasal septum on the left side, which couldn't really be seen before the surgery because it's in a part of the septum that's hard to see. But we have to do a fairly complex, almost a reconstruction of the nostril here. That means we're going to open the tip of the nose a bit further now. Now we're going to divide the nostril and fold it over. So now we already have good symmetry, but that's typical with nose surgeries. It's always a bit of a surprise. No matter what test you do beforehand on site, it often looks a bit different. She has another problem as well. Namely, there are fibers from the orbicularis oris muscle that pull the nose towards the nasal septum, and when laughing, they can either pull the tip of the nose down, and that just bothers her, you know. We have to somehow correct that as well. But I see that the nasal septum is also quite crooked here at the front. So I'm reshaping the tip of the nose now. We've corrected the one alar cartilage. Now we're refining the tip of the nose, and then we'll look at the projection and the rotation. We've now taken a nose that had a slight hump and was drooping heavily, so the angle between the lip and the nose was acute, the nasolabial angle. And from that, we've now made a nose with an open nasolabial angle of over 90 degrees. I'd say it's about 95 degrees. The bridge of the nose is very subtly lower than the tip of the nose. The tip of the nose had a very severe deformity with very asymmetrical alar cartilages, and now we're finished. I think the result isn't super unnatural now, but it also still fits her face. The nose is naturally shorter overall, now slightly curved, but nothing extreme, and that's supposed to be the goal here. We're going to close it up now. I'm not even sure if we'll apply a cast. Maybe we'll even just use a tape bandage. Surprisingly, there's often less swelling when you only use tape, at least in the long term. She doesn't want everyone to comment on her nose, so we want to harmonize the whole thing. When this is finished, most people won't understand what happened to her face and won't even notice. It sounds strange at first, but that's how it is, and it's actually a good thing. Most patients actually prefer it if not everyone immediately asks them about their surgery. We had to release that muscle there that was always pulling the tip of her nose downwards. It was really pronounced in her case. So the muscle fibers basically extended into the anterior nasal septum and to the base of the alar cartilages. Usually you can't really see it properly, you can only guess it's there. But here you could clearly see these reddish muscle fibers. A very interesting finding. Okay, I'll leave the cast off for now. Satisfied?
But later, but maybe later.
So we're finished with the rhinoplasty now. We've established symmetry at the tip of the nose and corrected the split in the tip, which she also had. We corrected the deviated anterior septum, closed the hole, rotated the tip upwards, and slightly reduced the projection. Then we adjusted the bridge so the small hump is gone, giving her a straight bridge that rises slightly towards the tip. So in the end, it wasn't that little after all. We're done with that now, and now we'll take care of the breast.